Oh my gosh, Dr. Anna, I am so excited. As you heard in my intro, Anna is one of my favorite people, and I'm so glad she's here in Dallas.
Aw,
Because I get to ask her
aw,
all the
thank
time.
you.
But I am so excited to talk to you, Dr. Anna. But I think I always ask the question because I think as women, we connect through story. And I would love for you to share your story, how you got here, because everybody in functional medicine, for the most part, has a story. And I think it helps people understand no matter where they're at, there's a place to go and there's always improvement. So can you share it? Let us know.
Yeah, absolutely, absolutely. I mean, I grew up with a very, first generation American. So food as medicine, kind of like, oh, we drink this tea for this, we use this olive oil, rub it on your belly if you're having, stomach issues. I mean, like different things like that. And so one of the things that I recognized at a young age was that there's a difference between women's and men's healthcare. So I became a very strong women's health advocate, as I realized, as in the case of my mom, who had diabetes and heart disease from her 30s with her first cardiac bypass in 50s, that the research that was done on men. So her care was based on research done on men. I'm like, wait, women and men are different. Now I was 16 when I was thinking about that. She was 52 having her first heart surgery. So that really drove me into women's health, and then functional medicine, because as a practicing OBGYN, I knew that we had to get to the core of the disease issues. And through my own mess, through my own early infertility at 39 years old and early menopause at 39 years old, I mean, that for me and my family at the time, trying to have a baby and not being able to, having helped infertility, have infertile patients get pregnant all the time, to feel like my doctor's bag was empty, was devastation on devastation. And it was a post-traumatic early menopause, but still my reproductive endocrinology colleagues said the only chance you'll have another baby is egg donation. And that was, of course, after I failed the highest doses of injectable meds. And that took me, Betty, as you know, on a journey around the world looking for answers. It was over a year-long sabbatical, and I met healers serendipitously from around the world. And as a result of that journey and learning some medicinal foods, and that where I created my first product, Mighty Maca Plus, because the superfoods that I experienced as I traveled, I'm like, I didn't have this as a tool for my patients, let alone for me. And but I came back, reversing early menopause, and at 41 became pregnant with my daughter Ava Marie. And so now I'm 55 with a soon to be 14-year-old. Here we go. So that's been part of the journey. And then to, have struggled with weight my entire life and hormone imbalance issues. And, really I've been over 240 pounds at one time, suffering with severe hair loss, on the road to prediabetes and all of those things. And genetically, as we've studied my genetics as well, looking on both sides of the family, high risk for cardiovascular disease, high risk for diabetes, methylation defects, I mean, name it, I've got it, right? And so that led me into discovering the keto green lifestyle, which helped balance my hormones, reverse early menopause again at 48, and improve my weight, my mental capacity. I mean, I remember the brain fog was so thick I couldn't see my hand in front of my face. That's how thick the brain fog was. I mean, it's terrible, and you can't do that as a single mom of teenage girls, for sure. So there's certainly a lot that's happened in my life to bring me to this point, and why I'm so passionate about getting this information, which is honestly 99% in the hands of each individual. Each individual can be empowered with this information without needing a prescription pad or a drug or a surgical procedure. And that's what I really want people to know. So they don't have to suffer like my parents did. They don't have to suffer like I did and be told like, oh, well, this is it. No other option, right?
Absolutely. So I want to back up a little bit, because you brought up one of your products, which is a astronomically fabulous product, I must say. And, I think here in the West, we aren't as familiar with Maca, but can you kind of go into Maca's properties and why every woman probably needs to be doing Mighty Maca?
Yeah, definitely. Maca, not to be confused with matcha. Matcha is a tea, and maca is actually like a root. It looks like a turnip almost, and it grows at the high altitudes in the Andes of Peru. That's where it originates from, and that's where my maca is from. That's where I experienced maca, was in Peru. My nurse who had been with me in my practice in Georgia was from Peru. Her family was from Peru. She was actually a nurse midwife there. And they said, when you're infertile, drink maca. If you're tired, drink maca. If you're, and then they would elbow, my husband at the time, and he would say, if you're, it's called the Peruvian Viagra. So, of course, we're like, okay, let's drink some maca, right? But it's adaptogenic. So whether you're burnout or you're highly stressed, you've got the high cortisol or very low cortisol, maca comes in and it's adaptogenic, somewhat like resveratrol or turmeric in many of their functions as well. And it also is very high in arginine, which increases nitric oxide, which increases blood flow, which is how Viagra works. And I was like, whoa, this is something interesting as I started to dig into the science and the research. And it has been studied in menopausal women and been shown to improve all areas of sexual function, to improve hot flashes and mood swings. And I've definitely seen maca work wonders in both men and women. But for me, I could never take maca by itself. As I was traveling, I learned other superfoods, and I started to mix, I'm such a foodie, but I started to mix other superfoods with it. So number one, taste, like for example, adding in mangosteen, adding in some green tea, adding in certain different specialty superfoods, as well as some science-based superfoods like our, resveratrol and quercetin, and adding those into the formula to really add a comprehensive full body supportive nutrient. And especially when you're busy and you are burnt out. And for me, I think, mom raising kids and all these, many other things, all the hats we wear as women, it's hard to get all the nutrients we need, and much better to drink something in a smoothie or in a, elixir, like my little shot glass of Mighty Maca in the morning, than it is to take handfuls of pills. So this was my way I formulated it. And honestly, Betty, when I brought it into my practice, I'd been working, with different formulas in my kitchen. Then I went to a GMP certified manufacturer. And so my minimum order at that time had to be 500 canisters. I'm like, well, let me see if some of my patients would like, and I would give it to some of my patients. And they're like, oh my God, this is the best thing. It tastes good. I have so much energy. I no longer am struggling with hot flashes. Guys are like, oh, this is good, right? Like my libido's better than it has been in years. And so that's where it started, word of mouth being, a thing. And now it's distributed all over the world. So it is. And I'm really careful about clean ingredients, especially now with supply chain issues. That's one of the things we really look at too, because my kids drink maca, Mighty Maca Plus, the combination. And they've been, Ava Marie's been drinking it since she was 2.
Yeah. I think that's an important thing too, because, women might hear and go, oh, well, I'm past menopause. I don't need it. Or I'm not quite there yet. I may not need it. And I use it in women that might just be struggling with menstrual irregularities in their 20s, 30s, and 40s, maybe before they're really in that menopausal state. I will tell you, I did see a study looking at maca as possibly an adaptogenic treatment for possibly alopecia.
Oh, well, that would not surprise me. It's so interesting. It's been used in so many ways. And I think because of improved circulation and blood flow, I think that may be one of the reasons that it could improve alopecia. Plus it's adaptogenic. So it's going to help your adrenal hormones, because one of the reasons we lose hair is stress. Cortisol triggers testosterone to dihydrotestosterone conversion, causing this, androgenic male type of alopecia too. And very interesting. Yeah.
Yeah. So for those of you worried about hair loss, maca may actually help that out.
And if you can see my hair, and if I showed you the picture, and I sometimes do if I'm doing a presentation, I used to have hair loss way back to like the crown of my head, way back here. And so like, I know when my patients would come in with baggies of hair, they're like, I'm losing all this hair. I'm like, I'll check their thyroid, check your B vitamins, iron, all that standard stuff. And it would often come back normal. wasn't until I experienced it, and all those labs were normal, but it was stress related hair loss, until I got dug into the research to understand that cortisol triggers that conversion. So when we're stressed, we're converting testosterone to dihydrotestosterone, hence breakouts, hence hair loss. And anytime I start to see my hair coming out, I'm all over it, boy. It's like, all right, let's really work on, reducing cortisol and boosting up, the adaptogens, so increasing the Mighty Maca Plus. All of those things can really help with hair for sure.
Absolutely. So that brings me to some topics of hormones. And I'm sure, we get so much information about hormones, they're good, they're bad. And of course, we've had a lot of misinformation, particularly in the last 2 decades from the Women's Health Study. And as a practicing gynecologist, of course, you're somebody that not only did surgery, but you helped women with their hormones. Would you help maybe answer some of those questions about, are they safe? Are they not? When should I have them? When shouldn't I?
Oh, wow. Well, I think like bioidentical progesterone and adrenal support, adaptogenic or with DHEA, but preferably adaptogenic, like with Mighty Maca Plus, is essential menopause and beyond. And perimenopause, there's time to help support our body's natural hormone support. And this is one area, and I've lectured all over the world on hormones. I've trained physicians, I've done full day seminars on how to use and prescribe bioidentical hormones. And I would just say only bioidentical hormones. If you're on anything other than a bioidentical hormone, we really need to transition you. And not just the type of hormone, but how are we getting it? Are we getting it by a capsule that we're swallowing in our mouth? That can overburden our liver. And also the metabolites have to be addressed. So, post-menopause, I use bioidentical progesterone cream. I created my own balance cream to help with progesterone and pregnenolone, the combination of the two, plus some tripeptides in there. And I think that's really essential. And then supporting your adrenal glands, and that comes from a couple ways: the stress management. And in my platform, you hear me say a lot, it's the keto green way, the keto green lifestyle. And I make people check their urine pH for ketones and check their pH, because the urine pH above 7 is associated with decreased risk of heart disease, metabolic syndrome. And now we know the higher urine pH, the more you're pushing out uric acid, you're clearing uric acid. So that's associated with that too. And we know higher levels of uric acid above 4.4, right? I think it's 4.4, can be associated with all the metabolic syndromes. So decreased metabolism, and hence we're gaining weight and we don't even know. And it can be because of our diet being too high in purines, which is a complication with many keto diets. But that's why we need the green aspect, the alkalinizing aspect, but also to remember that cortisol, our stress hormone, is very acidifying. So unless we're checking our urine pH, we really need to identify it's not just what we eat, it's what we think, it's where we live, what we're exposed to, food sensitivity, stress, you name it, can all affect our body's physiology, creating more hormonal havoc as we age, because cortisol is going to decrease our progesterone. And we can't just give progesterone and not address the cortisol issue. That becomes another problem. And we can't just give testosterone and leave a woman, hanging on that, because stop the testosterone, you're going to have depression. Stop the testosterone and you've inhibited your body's natural production. There's a time and a place and a pace, like say pulsatile, for hormone replacement too. There's certain things that we want, especially in the younger population, we don't want to decrease your ability to produce your hormones naturally.
I agree. And one of the things that I see, because it's very popular now to get hormones. You see these hormone clinics that pop up, total men's solutions, all these different things. And I think sometimes people will kind of lump it together and go, well, if you just give somebody some testosterone or maybe increase their hormones a little bit, that's going to fix everything. And because you do feel a little bit better, most of the time, okay, women, if your libidos are a little bit better, we feel better, right?
Right.
But
sure.
But I find metabolically, often what I see is because there's underlying metabolic issues. Maybe there's insulin resistance and an inability to efficiently burn fat because we have adrenal problems and we've got insulin, all these other problems, that if that underlying activity is broken, adding that hormone may make you temporarily feel better, but it may actually make the metabolic syndrome, the weight gain, and all those other things worse, because testosterone is an anabolic growth hormone. So it's going to drive greater insulin resistance in a woman, not as much in a man. In men, it looks like it has a little bit more, helping with leaning out, but in women, it's not the same. Do you see that in people that come to, or just, come to your show and show up on your podcast and in your groups?
Yeah, I think there's a balance there, right? There's definitely a balance there. And if we are needing to replace testosterone, that we're looking at all the other hormones too, because otherwise we're affecting the entire, hypothalamic, pituitary, adrenal, gonadal, thyroid axis. So we really need to look at the whole picture. But I definitely think that, and it also depends on your body type. If you're already insulin resistant and we're giving you more testosterone, you're gonna bulk up more than someone who isn't, right? So depending on your genetics, it's never one size fits all. And that's where the art of medicine comes into play. Again, I'm a big advocate of bioidentical hormone replacement. So with or without a uterus, I think bioidentical progesterone post-menopause is like one of those essentials for sure, for sure. And it makes a big difference in the quality of our life, the quality of our sleep, the quality of our thinking and our thoughts. Just a huge benefit to it.
Awesome. Now I want to back up just so we can kind of mostly clarify keto green, because keto is very popular. But like you said, your keto green is bringing in that green aspect and the alkalizing aspect. Did you come about that by accident, or was it more in just your research or your own experience?
So that's just keto green. The combination of keto green came from when I was 48, and all of a sudden the scale popped up again 20 pounds without doing anything different. I mean, how many times have we heard that from our patients? And I was, I'd always check thyroid, do the workup, but yeah, what's causing this? And so when that happened to me, because I'd been well over 240 pounds, lost 80, kept it off for quite a long time, and that weight started without doing anything different. Anyone listening knows, like, you're like, when is that weight gain going to stop? I'll be 300 pounds before this ends. So I went pretty strict keto, very low carb, very strict keto, and I didn't feel good. I didn't feel good, and like I was just feeling cranky and irritable and on edge. And I was a single mom with a child and a wee one in elementary, a middle schooler, and a high schooler, all girls, right? And so it was like, whoa, well, what is you can't afford that you want a happy home, right? And so I was like, trying to understand, well, what's going on? What's the physiology here? Because I'd used ketogenic diets in my seizure patients and my, or types of ketogenic diets in my patients with candidiasis. And always then it occurred to me, the perimenopausal, menopausal women that I put on a very restricted carb diet would all say that I just don't like how I feel. I feel like I'm hitting a wall. And I said, what's going on? So I did what I would tell my patients to do whenever I detox them. And it's something I used to do quite frequently, check my urine pH. And I was as acidic as the urine pH paper meant, that read. So I was as acidic as the urine pH paper read, the lowest number on that scale. So who knows how exactly what my urine pH was, but a ketogenic, very acidifying diet, high stress life as a single mom, sole earner for my family. And so that was a huge aha moment. I'm like, I'm so acidic. No wonder I'm cranky. No wonder I'm not feeling well. I mean, this is an issue. So I started adding alkalinizers. The dark green leafy, sauteed up the beet greens, threw away the beets, sauteed the beet greens. Actually, I would say beets for my daughter's strawberry smoothie. And put a slice of beet in there, makes it a beautiful red color. That's a good hack for our moms listening. And so I, the herbs and spices, and I incorporated all this in, and it was really, I started feeling better. I started feeling like in ketosis and more alkaline, and checking the urine pH, get a nice pink on the ketone scale. just nutritional ketosis, we know is like 0.5, 0.6, not much, but getting a nice pink and getting alkaline at the same time, that is no small task. You guys, I recommend everyone try this in their life because it makes a huge difference on how we feel. And I felt this energized enlightenment, but even more so, the whole cortisol and urine acidity connection. I mean, I would go out. I didn't know that at that time. It's 2014, 2015. I'd go out for walks on the beach or do my gratitude journaling in the morning. And the days I did that, my urine pH was more alkaline all day versus when I shut off my alarm, I got up late, had to run all the kids to Starbucks and then to the schools. I was like, okay. So anyway, that made, I mean, that was like a high acidity all day. Didn't matter how good I ate. I could eat the very, very, very clean, very good, very alkalinizing, but that stress factor. And so, and then bringing in that self-care, these gratitude practices and the oxytocin empowering practices. And I love talking about oxytocin, the hormone of love, bonding, and connection. And the oxytocin turns out to be a very alkalinizing hormone on our physiology. So we can be like eating, a more of an acidic diet, but have fun, be laughing, have great sex. I mean, really have an amazing amount of oxytocin. Go out to friends with a movie, whatever, you're laughing, you're having a good time. That's oxytocin. And you'll see that your urine pH the next day will be quite alkaline. And that's the beauty of not just what we eat, but how our environment, how what we do and who we do it with affects our physiology. So it's the oxytocin cortisol kind of seesaw. And when we are so stressed for so long, we're feeling this disconnect. We feel like, I know I love my husband. I don't feel love for them. I know I love my work. I don't feel love for it. And that is never when you should make a decision. Never when you should make any impactful decisions on your life. So it is a physiology of divorce. It's a physiology of burnout. It's a physiology of quitting. It's a physiology of depression.
Absolutely. Absolutely. So I think this brings us to a really great subject matter that I think you're alluding to already. It's the idea of having pause, right? And you have a fabulous book that's getting ready to come out. But I think as women, and especially in this time of life, we're possibly for the first time ever, maybe considering a pause and probably don't even know how to pause, right? When the kids are maybe out of the house or getting closer, they might be able to do things a little bit on their own and starting to look at what is this next season of life. We have to think about that. And this is the time of that. So I want you to share about your new book coming out, because I think everybody needs this book. And I want you to talk about it.
Thank you. It's really a fun book. I do. I want it in everyone's hands. It's going to be fun, especially to work through together and in groups. But let me tell you, there is magic in the pause. And we don't realize that with menopause, right? So for menopause, we think of, what happens as you go older. You have these images of old and wrinkly and overweight, or the Crohn's. And I mean, they're very few beautiful images. So we have to create that beautiful image for ourselves. We have to redefine menopause. The Japanese call this time of life the second spring of life. The second spring. So the time beyond menopause, you're no longer reproductive. It's the second spring of life. And I want American women to own that. I want us to feel empowered, and I want us to redefine what it looks like, because the next generations are watching us. We have to, and they're having a tough time, right? These next generations are screen heavy, are influenced by false images and false reality and false news and, all kinds of, manipulative imaging, right? And so we have to be the example for them. And they're watching us. They're watching us, as the millennials say. You guys ruined it for our generation. Well, that's coming to an end. You guys have no excuse, because we're going to do this right. And that's what I want women to feel empowered to do. And so with menu pause, there's a whole nother pauses. We're pausing different foods, essentially, to empower our physiology to have low inflammation, hormone balance, and to break through whatever plateau that we are dealing with, whatever is blocking our success in taking the next right step, in achieving better health markers and achieving more energy and achieving more clarity. So if we decide we don't want to do something, we're really clear. It's not because we're burnout and exhausted. We're really clear if it's not a hell yes, it's a hell no. But there's none of this like that. Like I mentioned, the brain fog was so thick you can't see your hand in front of your face, right? We want to clear that. But this is where modern, this is where my medical institution, this is where we've fallen short in, is that many of the medications we write, many of the procedures we've done affect hormones and never address the underlying cause. And so we need to improve our body's own natural hormone balance. So with menopause, we're doing that. And guess what? Each plan is only 6 days. So in 5 different 6 days plans that each pause something that I have found to be extremely helpful in the women that I've been working with virtually and in person over the last many years. When I have to change something up, when what you're doing no longer is working, or we're hitting a block and we're not getting the results I'm expecting, I've had to pause something different. I've had to change things up for them. And sometimes it's, taking away nightshades. So my Keto Green Extreme plan for autoimmune. Sometimes it's adding carbohydrates. Let's add some in. That's my carbohydrate modification plan. Sometimes it's, going plant-based for 6 days. And so there's really magic in these pauses. So 5 different plans with shopping list, and we've got all kinds of bonuses like batch cooking guides. And I know that, cooking at home can seem burdensome. I've tried to make this as easy as possible. And again, if you do it in a group, each take a day.
Oh, yeah. Yeah, that would make it easy. Well, and I think, if there's anything we can say positive about this last experience with COVID, is maybe some of us have seen our kitchen more in the last 2 years than we did for maybe a decade prior, just because we were stuck at home, so there's no excuse.
No excuse. It's true.
There's no excuse. So what would you say to the woman that that is hearing that sort of idea of menopause and the pause, but they're like, I can't. There's too much on my plate. There's too much whatever, because we hear that a lot.
We can do anything for 6 days. We can do anything for 6 days. We really can. And it is, again, when you feel like you can't, but wow, what if I can double your capacity in a few days or a few weeks? Like, what if we can work together to double your capacity? And you're not going to feel that overwhelm. I mean, I get it. I'm a single mom, burnout, struggling, inflamed, in a mess, depressed, stressed, depressed, and hormones were a mess, right? I get that. I remember not, crying before I'd open my eyes because I just didn't know how I could handle the day. And I take that into deep consideration as they create this, because we nourish our body. We're going to nourish our souls. We're going to nourish our spirits. And I think I think that's something really important to remember. One of my favorite quotes from Aristotle is that the soul suffers when the body's ailing, and the body suffers when the soul is ailing. So, and I get that. I get that completely. And so we want to nourish. We start with nourishing our body with good food choices, making some pauses here and there. And it does include some easy intermittent fasting and some no more snacking kind of pauses. I mean, it's just critical, you guys, when we're especially, to decrease inflammation, to improve our body's genetic capacity, to boost our immune system, we just have to do this. So I would say, let me know. Let's talk about it. Work with a coach, get in a supportive community. Then we don't feel so overwhelmed. We can be so supportive. One of my biggest fans, like right now, and she's, I've hired her to work in my customer service to help me with my groups. Her name's Jeannie. I believe she'll be featured in First for Women magazine coming up. She's been doing Keto Green for 5, 6, 7 years now, something like that. But when she came in, her daughter was getting married. She was overwhelmed. She was stressed. She had 2, sick parents, caregiver, and she like fumbled through my first Magic Menopause, my first Magic Menopause class. And then she just took one thing that made a difference and stuck with that one thing. And then she came back the next year and did the class again. I mean, she just stuck with it. I mean, her story is magnificent. And not only did that improve her life and her quality of life, but her daughter's done it too. Her daughter's a keto green superstar. I mean, she's lost, I don't know, 65 pounds. She's amazing, you know, at the top of her game and self-confident and just a great inspiration to so many of us. So that's the difference. You can go from that to being the best you, living in your second spring. And I don't want any woman to give up on themselves.
No, I completely agree with you. I mean, that's the whole center of this podcast is we have this extraordinary opportunity in life in front of us, and we need to be able to jump in. But I think you bring up a really good point. A lot of times we think kind of all or none. I have to either be perfect at it or I'm not on it. And it really is, it's small incremental changes, and often maybe just one. And once we master one, then we have the efficacy to then step into the next change, you know. And that's the beauty of your menu pause is we have little short, anybody can do anything for 6 days changes to really be able to give the opportunity to see what happens to the body to improve it. So I completely agree. Now I'm going to do a shameless plug because I have to talk about this product because, you know, women don't really like to talk about, you know, their parts down there, the netherworld, you know, and
the most important real estate of their body, man.
That's right. That's right. So I want you to talk about Julva because a lot of women suffer with discomfort, with things like vaginal dryness and even increases in yeast infections and other things because the tissues are really suffering. And I think Julva is a real game changer for that. Can you talk about it?
Yeah, no, absolutely. So Julva is the cream I created because when I was that, you know, before I got into my keto green lifestyle, I was that burnout mom and I was struggling myself, having delivered 4 big babies with urinary leakage, dryness, I mean, just name it. But my patients were like, Dr. Anna, no one will write your prescriptions for us, your creams, your topical creams. I've been working with compounding pharmacists, customizing creams, training physicians, right? And so I was like, okay, well, I closed my practice at that time. So I was like, let me come up with something over the counter that's better than anything I can write to you on a prescription. So that's how Julva was born. And it has DHEA, it has plant stem cells from the alpine rose. It has emu oil, coconut oil, shea butter. I mean, and it works. It is game changing. It really works. It's a beautiful formula. And so you apply it clitoris to anus. I mean, your gynecologist isn't even telling you this stuff. You guys, we have to take care of this because clitoral atrophy happens, just like we get laugh lines or marionette lines. I was noticing earlier, smile lines, laugh lines, you know, we're going to get changes down there and that doesn't serve us. So and hemorrhoids and fissures and, you know, and dryness, lack of sensation or sexual pleasure. We want that for the rest of our lives. I mean, guys are coming home with testosterone and Viagra and women are like, don't come near me, right? We have to regenerate and we can do that. The vaginal tissue is amazing. Like I have a quiz, I'm renaming it like, how old is your vajayjay? Because I want people to say like, I'm 55 and I have the vajayjay of a 25-year-old, right?
That's right. Yeah, mine's pumping iron and running marathons.
Yes, exactly. So good.
So good. But yeah, we especially, you know, I would say a lot of us are kind of fearful to talk about it, fearful to explore it, but it really is, it's valuable real estate and it's a big part of pleasure, right?
Yeah.
Sexual pleasure is part of this game and we can't go, forget it, I'm postmenopausal, no longer going to have any pleasure, particularly sexually. Like that's no way to live.
No. And I heard a urologist say recently, and she said, man, estrogen's like your sunscreen. You should be using that. And I'm like, estrogen covers the mucosa. It doesn't penetrate the deeper tissues. And if that's all you're giving your patients, you're doing them a disservice. Like this research is decades old. Okay, I've been doing this since 1999. And it is nowhere near, I mean, less than 1% of physicians even are aware that you can compound formulas, you know, and so it is an art of medicine. But to you know, and this is where physicians, you know, we're not trained in this customization. We've got other fires to put out, right, when we're in training. So this is from, working to solve my patients' problems, working to solve my problems.
Yeah.
Yeah.
Yes.
And your clinic, like I have clinics all over the world that are like big fans of Julva and Mighty Maca Plus, and you see differences in your patients. You've made them happy. And yeah, that's something. That's why we went to medicine in the first place.
Exactly. So yeah, so Julva, not that I'm doing shameless plugs for Dr. Anna's products, but I'm just saying that your products are game changers. They're not just lip service, they are real game changers for women's health. And I think it's really important.
Oh,
And
speak
so
of lip service, because we started using Julva for the lips. Now we have my Kiss formula. This is hot off the presses. We just got it. It's not even on the website yet. So our upper lips wrinkle too,
yes,
So I was always using it on my upper lips, and someone complimented me. And I'm like, oh, I'm using my Julva. And she's like, what, you're using what's for down there, up here? And I was like, I'll make you a formula that's just for up here. So
I was like, I don't have a tube of that yet. I need some.
I will get you some. We will meet up and I will give you some. I will give you one. I seriously just got it. We got delayed, of course, with a lot of things, and perfectionism is one of my problems. But so this is Julva Kiss formula for the
Love
upper
that.
lips. So it's coming in a lip duo, upper lips and lower lips. I've got you covered.
Awesome. So tell everybody when your book's coming out.
Yeah, so menopause, and it's got tons of colored photography, beautiful recipes, all the plans, all the shopping lists. I mean, and it's a beautiful, my publisher, Rodale, and my editor, Barney Cochran, did an amazing job here and allowed us to get all this beautiful food photography. Caroline Eli did all the food photography. It's just a beautiful, beautiful book. And it is out April 12th. It's available for pre-order, and on my website we've got a book page to put in your receipt number and get some of our. We'll give you that. You have that link, Betty. So to add that link, and you'll get all the book bonuses that we have, including batch cooking guides. I mean, really want to make this easy and fun, and cooking videos and all kinds of good stuff for you to really get the keto green lifestyle and learn through these five different pauses here.
That's awesome. So we'll have the link in the show notes so everybody can go to it, because if you go straight there without going to the link, you won't get all the bonus content. And it's just like, going and buying makeup and you get the extra stuff. You want to get your bonuses.
So true.
Well, Dr. Anna, is there anything else you want to tell our lovely listeners at Dysfunctional Life before the end of our chit chat?
Yeah, I think the number one thing is a lot of times you're dealing with so many illnesses. You may have had breast cancer, autoimmune disease, and you feel like, you're just waiting for the next shoe to drop. I mean, I get that. I had traumatic PTSD. What I want people to feel is empowered, to be able to be present in your body and look forward, and, and have that strength and resilience to handle anything that comes our way, and create bodies that are inhospitable to cancer and other diseases. So I'm here. I'm just a girlfriend doctor, and I'm here with you every step of the way, and I'm on this journey with you too. So I want to encourage you to, I would say invest in yourself, the time that it takes to prepare these meals, the, time to look at what could be your next right step, and to feel encouraged that you're heading into your second spring of life. And I want you to enjoy every minute with love, connection, and so much gratitude. Betty, love you. Thanks for having me.
Gosh, love you, Anna. Thank you. Okay, everybody, make sure you hit the show notes so you can get to Menopause the book, and go do it now before it comes out so you can get it when it's hot off the press in April. All right. Thank you, Dr. Anna. Love you, dear.
Thank you.